I'm Antoni Chan, consultant rheumatologist from the United Kingdom, reporting at EULAR 2022 here in Copenhagen. And today I want to talk to you about gender or sex differences in terms of the clinical outcomes and also imaging in the field of axial spondyloarthritis. Increasingly, over the last few years, this has been becoming an increasing topic in terms of how we assess our patient, that one size doesn't fit all, and we should consider sex differences in our patients when evaluating their clinical outcomes or when we are conducting investigations such as imaging. So male and females may respond differently in terms of treatments that we give them in axial spondyloarthritis. I want to highlight two abstracts that are important here at EULAR 22. Firstly is OP0013, which is the study from EULAR and colleagues, where they look at the appearance on the imaging in terms of patients having axial spondyloarthritis. We know that from our previous understanding, structural changes happen earlier in male patients with axial spondyloarthritis, and in female patients, they tend to have more peripheral arthritis. And this sometimes can lead to delays in diagnosis, as a lot of our imaging in axial spondyloarthritis is based on the spine and not in the peripheral joints. In this study, where they had over 1,000 patients, they looked for the typical changes in the MRI and in the spine, such as sclerosis, ankylosis, fat metaplasia, and also bone marrow edema and erosions. And what they did is they tried to determine whether the prevalence of these changes on the MRI were more common in either the males or the females. And what they found was in females, there was an increased expression of two types of changes. Firstly, sclerosis, and then the second one, bone marrow edema. But in the males, they had commonly ankylosis and also fat metaplasia. In particular, the area of ankylosis, this was found to be 40 odds ratio compared to 4 in the female group. So there's a 10-time increased prevalence of ankylosis in the male patients compared to female. And I think this is important because as we think about the use of plain radiographs in terms of determining whether patients have ankylosis or whether they are in the non-radiographic arm, these changes may not be very prevalent in the female patients. And perhaps this is why the prevalence of the non-radiographic changes are much commonly seen in females, and also the delays in diagnosis can be commoner in females as well, as these changes are often only detected later on in X-rays or MRIs, and ankylosis is a more common finding in males compared to females. The second abstract I want to highlight is OP0020 by Hellerman, and this is looking at the response of biologics in patients with ankylosing spondylitis. They looked at the EUROSPA study where they had 4 randomized control trials, and they were looking at two things. Firstly, the impact of biologics on treatment, where they look at the S-CRP at 6 months. And the percentage improvement was higher in males compared to females. Females had a 15% lower response compared to males at 6 months using the S-CRP in terms of clinically important improvement. So females responded less well than males in terms of biologic treatment in this study. Secondly, in terms of retention rate, when they went on to 24 months or 2 years of treatment, there were fewer females than males that retained the treatment at 2 years compared to males. So this was higher in the male group compared to the females. So again, this is telling us two things. Firstly, in terms of how we assess our patients, in terms of making a diagnosis using MRI or X-rays, that they may be sex differences. And secondly, when we treat our patients, there may also be differences. Again, the presentation may be different. There might be more axial disease in men in the early stages, especially ankylosis, and maybe more peripheral involvement in females in the early stages of disease, hence leading to the differences that we see on the imaging and also in some of the outcomes that we are assessing, which can often be more focused on the spine than they are with the peripheral joints. So I think this is an important topic for us to consider going forward, and these two abstracts help us to understand this better. I'm Antoni Chan reporting for Room Now here at EULAR 2022. Thank you.